Greetings of peace. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Good day to each and everyone. So for today's video, I will start discussing the first part of your Unit 7, Nursing as an Art, Science, and a Caring Profession. Today, we are exploring why nursing is much more than just clinical procedures. While the science of nursing provides us with the evidence based facts, the art of nursing is what makes us as a helping profession. According to our curriculum, caring is the most unique quality that delineates nursing from every other profession. It involves a connection and mutual recognition between the nurse and the client. So now let's start our discussion. Now, in the development of nursing and art and science, according in the during the scientific revolution in 1917 and 18th century, age of reason was generated. Now, it is the philosophical movement known as French Enlightenment. It was the search to understand, to control, manipulate nature through rational and empirical means. Revolution and changes in physics and astronomy. So, during the French Enlightenment, the science of 17th century was based on a new method of inquiry. It involved mathematical deception of nature and the analytical method of reasoning. The Enlightenment project aimed of civilizing all, of implementing its ideal of social betterment through power of reason. It is based on beliefs in the universal superiority of the knowledge and values. During the French Enlightenment, there are two ways of thinking in art. One concerning the cultural production of knowledge, and the other is art of living, which is for men to be pursuit of dream of freedom through rational as doers or thinkers. Separation of art and science occurred in the educational structure that emerged in the Enlightenment with the rise of modern profession. Knowledge has two dimensions of art and science within universities and faculties. Both art and science work completely independently, and there is a search for human perfectibility was major issue which linked to a philosophy of humanism. The human subject was seemed to be male. Now, based on the nursing and as an art and science during the Florence Nightingale era, the nature of modern art and science has evolved through influence by Florence Nightingale ideas, which rely on the Florence Nightingale school of thoughts. So it was developed. The school of thought of Florence Nightingale was developed and sustained within the training schools. The program was in the hospitals Britain, Australia, New Zealand, United States, and other countries. Accordingly, nursing education and practice counts nursing as an art by involving the feminine virtues. Again, it was accepted as art in nursing was focused on involving the feminine virtues as nursing is a female occupation or profession. So, science is more out of place. Okay? Scientific initiative was a male in the hospital and medical context was belonged to the doctor. So, during the Florence Nightingale era, the nursing only revolves around the woman. And why is it accepted as the nursing of art was accepted due to the feminism or due to being feminine of a quality of a woman nurse. Now, for the science to be more accepted, it was then the scientific initiative was more on male, no? Which belongs usually on the doctors. Okay? Now, during Nightingale's training program, it was a model for many training schools in Britain and overseas. Nurses argues that qualities of trustworthiness, neatness, quaintness, sobriety, and honesty and truthfulness. Now, through this nurse training, this assured that they didn't wish to take any of the doctor's function. So Isabella Raffi was the first trained matron of the Melbourne Hospital. Noted that we are in great measure the handmaid of the medical man and our function in this particular in this detail. During the based on Florence Nightingale's school of thought, there is a division of art and science within modern secular professional nursing of the Nightingale school of thought, described as gendered division, wherein nursing as an art is focused mainly or done by feminine or female nurses, while the science is usually done by male doctors, which is supposed to be focused on the evidence based or facts. Okay, so nursing as feminine art was developed through character training, which resulted of non-assertiveness, obedience, and compliance. Nursing arts includes bathing, bed making, positioning patients, and comforting techniques, while the nursing science focused on nursing courses, such as improving or understanding diseases, okay, signs and symptoms of specific illnesses. So that was the focus of the science, okay. Now, based on nursing Nightingale School of Thought, nursing education was a task of orientation and the modeling of a set of appropriate attitudes with hospital training schools to produce nurses who exemplifies the feminine ideal. The science is a rational and objective world of men. In medicine, man is one domain, where again the men's subject were the minds, and the woman's subject or object were the bodies. Now, hospital education nurse training change occurred, including considerable strengthening of the science context. Limitation appeared to the genderization of nursing as a feminine art that prevent nurses to act as independent subjects. So based on the school of thought of Florence Nightingale, they highlighted that the nursing as an art is the feminine characteristics of a female nurses. So the science was not really there in the context. Now, as time passes by, there have been changes occurred during the training. They are now limiting the genderization of nursing, and they include different contexts in science in order for the profession to act as an independent subject. Now, in today's era, okay, nursing as an art and science in today's era, in 1919, four-year entry to program established in the university to ensure the development of knowledge in a systematic and orderly way. In an orderly way. In 1950, training nurse scientist program developed in multiple universities that increased the interest of theoretical and scientific basis of practice. So during this time, there was an increasing interest of improving and including the theoretical and scientific basis of practice for nursing. Okay, so in 1950s to 1980s, theories of nursing included in the concept of nursing to understand biological, behavioral, social, and cultural factors in health and illness. So during this era, Nursing as an art focused on the nursing as an art, which focused by the Nightingale School idea, was the nature of nursing art as an expression of the essential goodness of feminine virtues persist in contemporary nursing practice. Now, nursing was called the conscience of the healthcare system, where nurses are major keepers of morality, goodness, honesty, and ethics of client care. Healthcare provision believe that nurses exemplify feminine ideal and have wide community support. Based by Munhall or reported by Munhall, nursing identified as a humanistic discipline adhering to a basic philosophy focused on individually and belief that the action of men are in some sense free. University-based nursing education in US moved away from Nightingale School to set out another philosophy of discipline to provide the basis for artistic practice. Nursing education aimed to produce practitioner with both scientific orientation and humanistic approach or humanistic in practice. So actually during the time of Nightingale, it focuses merely on highlighting the feminine action, because we do believe that during that time females are the one, or women are the one responsible for taking care of somebody. Now, as the time evolved, as time passed by, okay, they now understood that this profession needs to be a scientific, or needs to have a scientific concept for it to become a independent subject or independent profession. Because if not, then we may be always dependent on the doctors. So during this new era, or in today's era, nursing education aimed to provide or to produce practitioners with both scientific in orientation and humanistic in practice. Now, nursing as an art based on Munhall, educational preparation aims and the scope of science and art differ significantly, and transfer both the realistic of practice is a complex process. Based on Holden, he argued that caring role in nursing pushes nursing into the domain of the arts. Nursing that embraces high technology is pushed into the domain of science. So, accordingly, there were debates on how to accept nursing, if it's an art or if it's a nursing. Now, which is now today it is accepted as nursing as an art and nursing as a science. However, during this time there were debates because of the feminine role and focusing on caring. They believe it is more on the arts. Okay, so another Jennings and Peplau suggest that art and science come together in practice. Okay, so we can do that, no? Focused on caring while giving interventions focused on scientific context. So they can come together. Okay, so nursing as a science focused on behavioral science, holistic science, and caring science were the conceptual models for nursing practice and the basis for nursing science. Nursing theories were engaged to develop nursing science knowledge that linked to practice. In 1973, the first national conference supported the classification of nursing diagnosis. So this nursing diagnosis is sought to identify and classify the phenomena of nursing. The development of nursing science has two broad approaches: defining the domain of nursing theoretically and then testing proposition empirically. Developing ways to identify the phenomena of nursing and classifies them, and both were consist with prevailing philosophies of science. Now, nursing as a contemporary secular profession has developed out of the idea about the essential nature of woman, and as a science and art was challenged to shift of nursing education into university in the US to be nursing as a science and an art. Healthcare sectors and clinical area responds to this rapidly transforming for quantifiable indicators of cost effectiveness and quality outcomes. So collaboration between nursing and other disciplines contributing the development, the evaluation of standardized pathways, and developing the evidence-based practice. Now again, why nursing is an art? Because nursing is a helping or a caring position or profession. Caring and caring alone is the most unique quality of nursing profession and one that delineates nursing from other profession. Caring means that people, relationships, and things matter. It is the central to all helping professions and enables people to create meaning in their lives. Caring as helping to grow or helping the other to grow. So, example, imagine a patient, okay, who has just undergone a limb amputation. The science is changing the dressing correctly, while the art is sitting with them, acknowledging their grief, and providing the patient they need to grow into their new reality at their own pace. So that's really a difference on that. Okay. So caring practice involves connection, mutual recognition, and involvement between the nurse and the client. So there we have here different major ingredients in nursing or in caring. So to practice nursing as an art, we must utilize specific ingredients of caring. So first we have here knowing. Knowing, I have focused on understanding others' needs and how to respond to these needs. Example, noticing that the patient becomes anxious when their family leaves and adjusting your schedule to check on them more frequently during those times, especially if they're only left behind, okay, because the family leaves for work or anything else, so you have to visit them frequently. Another is alternating rhythms, moving back and forth between the immediate and long-term meaning of behavior or long-term goals. So example, helping a patient manage acute pain today while simultaneously teaching them exercises for their long-term recovery. So you're not just focused on the immediate need, you are also focused on the long-term needs of your patient. Another is patience. That I think this is one of the biggest ingredients that is really important in our caring professions. Patience, because in patience we enable other to grow and in his or own way and time. We have to respect autonomy. We have to respect the own pacing of our patients. Okay. So next is honesty. It is focused on awareness and openness to one's feelings and a genuineness in caring for the others. So another is trust, the very most important in any relationship. Because trust is the most important element in the nurse-patient relationship. So admitting to a patient or colleague when you don't have an immediate answer but promising to find it, which builds honesty and trust. So humility, acknowledging that there is more to learn, allows us to acknowledge that there is always more to learn. Okay? So hope, belief in the possibilities of other growth. Okay? And lastly, the courage or the sense of going into the unknown, especially if the patient, or example, a cancer patient, so he or she doesn't know what's the future. What is the future? What will be the future of his or her condition? So by having courage to take care of them, then you can what they call this, help the patient in any way fighting the future. Okay, so now let's talk about the different nursing theories in caring. Okay, according to Florence Nightingale, mother of modern nursing, nursing oath to signify the proper use of fresh air, light, warm, cleanliness, quiet, and proper selection and administration of diet. So this part of the environmental theory, the art here is the proper use of your fresh air, light, warmth, cleanliness, quiet, and proper selection administration of diet to allow nature to act on the patient. So that's the part of nursing as an art on the theory of Florence Nightingale. So for the theory of Hildegard Peplau, nursing as is a healing art or therapeutic of human relationship between an individual who is sick or in need of health services. So nursing is viewed as an interpersonal process because it involves interaction between the nurse and patient to have achieve or to achieve a common goal. So Hildegard Peplau defined nursing as a healing art of human relationships. Example, a nurse helping a psychiatric patient identify triggers for anxiety through therapeutic communication. So, Hildegard Peplau highlights the therapeutic reuse of self or therapeutic relationship or therapeutic communication. Now, for Virginia Henderson, viewed the nurse's role as the assisting the individual or sick or well in the performance of those activities contributing to health or its recovery or to a peaceful death. Or basically, Virginia Henderson viewed the nurse's role as assisting the individual in performing the 14 basic components of care from breathing normally to worshiping according to one's faith. So according to her, nursing as an art and nursing in caring in nursing focused on helping an individual achieve these 14 components of basic nursing care. So breathe normally, eat and drink adequately, eliminate body waste, move and maintain desirable posture, sleep and rest, select suitable clothes, maintain body temperature, keep body clean and well groomed, avoid dangers in the environment and avoid injuring others, communicate with others, worship according to one's faith, work in such a way that there is a sense of accomplishment, play or participate in recreation, learn and discover or satisfy curiosity that lead to normal development. So according to Lydia Hall, participation in care, core, and cure aspects of patient care, and the care wherein care is the sole function of the nurse. The core and the cure are shared with other members of the healthcare team. The purpose of care is to achieve an interpersonal relationship with the individual that will facilitate the development of core. So again, the care is the person, which is the therapeutic use of self. The core is the body, which is the intimate bodily core. And the cure is the disease we're seeing through the medical care. Now, according to Dorothea Orem, another nursing theorist, nursing is needed when the self-care demands are greater than the self-care abilities. So accordingly, there are 3 steps of nursing process focused on diagnosis and prescription, design of nursing system and planning for the delivery of care, and production and management of nursing systems. Again, based on Dorothea Orem, okay, based on her theory self-care deficit, nursing is needed when the self-care demands are greater than the ability of self-care. So, if the person cannot take care of themselves, so there is an increased demand for self-care. Okay? So again, 3 classification of nursing systems accordingly. We have wholly compensatory, partially compensatory, and supportive educative. So wholly compensatory, these are people who are socially dependent on others to exist. Partially compensatory, where both nurse and patient care measures And then in supportive educative person is able to perform activities of daily living but cannot do without assistance. Now, another theories, we have Dorothy Jensen. According to her, the primary goal of nursing is to foster equilibrium within the health illness continuum. Another, we have Faye Glenn Abdallah. Nursing is broadly grouped into 21 problem areas to guide care and promote the use of nursing judgment. Nursing is a comprehensive service that is based on art and science and aims to help people, sick or well, cope with their health needs. So we have here the key concepts of 21 nursing problems: to maintain good hygiene, to promote optimal activity, exercise, rest, and sleep, to promote safety, to maintain good body mechanics, to facilitate maintenance of a supply of oxygen, to facilitate the maintenance of nutrition, to facilitate maintenance of elimination, to facilitate the maintenance of fluid and electrolyte balance, to recognize the physiologic response of the body to the disease conditions, to facilitate the maintenance of regulatory mechanisms and functions, to facilitate maintenance of sensory function, to identify and accept positive and negative expressions and feelings and reactions, to identify and accept the interrelated of emotions and illness, to facilitate the maintenance of effective verbal and non-verbal communication, to promote the development of productive interpersonal relationship, to facilitate progress towards achievement, to create and maintain therapeutic environment, to facilitate awareness of self as an individual with varying needs, to accept the optimum possible goals, to use community resources as an aid in resolving problems, and lastly, to understand the role of social problems as influencing factors. So another theories, by Imogen King, a process of action, reaction, and interaction whereby nurse and patient share information about their perception in the nursing situation. Another theorists, we have Martha Rogers. Nursing is an art and science that is humanistic and humanitarian. Nurses should participate in the process of change. Next, we have based by Sister Callista Roy. Nursing is the promotion of four of the adaptive responses in relation to the four adaptive modes, namely the self-concept, interdependence, physiologic function, and role function. According to Jean Watson, nursing is concerned with promoting health, preventing illness, caring for the sick, and restoring health. Caring is defined as nurturant way of responding to a valued client with whom the nurse feels commitment and responsibility. For Madeline Leininger, nursing is a learned humanistic and scientific profession and discipline which is focused on human care phenomena, or the concept of transcultural nursing or ethno-nursing. So, So, whether it is thought or it is through Faye Glenn Abdallah's 21 nursing problem or Sister Callista Roy's focus of adapted responses, the common thread is that nursing is a learned scientific profession that must be delivered with the heart of an artist. So, you as the nurse, you are an artist and you should have a heart that has that learned that nursing is a scientific profession and an art. Okay, so in order to do that, you have to accept that nursing is a helping profession focused on providing interventions in scientific context. So that would be all for the first part of your Unit 7. Thank you for watching and God bless.